We are D&P Bioinnovations, a regenerative medicine startup focused on repairing damaged organs. We are developing an implantable medical device to regenerate a damaged esophagus, the organ that provides food to the stomach. Imagine not being able to ingest food because your esophagus is severely damaged, and you have to rely on an external feeding tube just to survive. This is the case for those who suffer from esophageal cancer, and most commonly in children, where poisonous ingestions are fatal, in which their only treatment option is to undergo a gruesome gastric pull-up surgery, which involves cutting out a damaged portion of their esophagus, such as a tumor, and then literally pulling up the stomach to that of the missing pathological tissue. This surgery on average costs over $100,000. Moreover, the stomach is not a great substitute for an esophagus. And this leads to a very low quality of life for the patient, as they often have to rely on feeding tubes for the length of their survival. Post-operative complications are as high as 80%, and the 5-year survival rate is less than 20%. Essentially, this is a life-ending procedure. Our solution to spare the stomach while being able to effectively repair a damaged portion of the esophagus is to cut out the impaired area and then implant our patented dissolvable medical device into the resected voided region of the organ. And this can be implanted by our direct customer, the thoracic surgeon, through minimally invasive endoscopic techniques. It is then expected the device will dissolve away, promoting esophageal tissue regeneration within the body, increasing the quality of life and survival of the patient. We also aim to save over $160,000 in combined procedural and follow-up medical reimbursable costs per treatment than compared to the gastric pull-up surgery standard, while dramatically increasing the quality of life of the patient. And our product is developed by utilizing our proprietary source of wound regenerative induced allogeneic stem cells, and then implementing them onto our unique electrospun biomaterial design. We then grow the cellular material construct in a bioreactor. Then we go through our key scientific process of washing the cells away, leaving only the secreted therapeutic factors from the stem cells that are important for promoting esophageal tissue regeneration within the body. Ultimately, this deems our technology as a medical device that can be sterilely packaged and delivered off the shelf in the clinic, in which the thoracic surgeon can open up the package and deliver the device at their discretion. And we do have IP filed on this unique innovation. We have a working prototype that has shown promising results in our preclinical animal studies. Furthermore, the scanning electron micrograph on the right illustrates that esophageal precursor cells with the circle on the left in the micrograph can grow in a monolayer format that is conducive for esophageal tissue regeneration. The circle on the right of the micrograph illustrates the unique nanofiber architecture of our materials on our device. And our product will address the conservative $750 million US annual market of those who suffer from advanced Barrett's esophagus, which is chronic regurgitation of stomach acid, esophageal cancer, birth defects of the esophagus, and in pediatrics where poisonous ingestions are fatal. Worldwide, the conservative annual market is over $17 billion. Esophageal cancer, a very aggressive disease, is prevalent in the regions from Asia to Middle East and to some parts of Africa. Specifically in China, over 250,000 per year will suffer from esophageal cancer, and thus we see our product being very useful in these regions of the world. We have tested our technology in over 7 different diseased animal models. D&P Bioinnovations is focused on regenerating a damaged esophagus. However, we do envision our product being a platform technology that can regenerate damaged gastrointestinal ulcers, tendons and ligaments, muscle, blood vessels, and nerves. Nevertheless, D&P Bioinnovations is focused on treating this dire unmet medical need of a severely impaired esophagus, in which the patient has no other alternative than to undergo a gruesome gastric pull-up surgery. We are the superb alternative in treating a severely damaged esophagus, ultimately increasing the quality of life and the survival of the patients we aim to treat. Thank you.